Hi, my name is Dr. Penn. I'm an emergency room veterinarian. I've been practicing for about 15 years now. And, being an emergency room vet, we see an awful lot of different cases, and we see a lot of the same cases. One of the more common cases that we see are what we call blocked toms, blocked cats, essentially little male kitties, specifically males, that end up with too much mineralization in their urethras, which is the outflow tract from the urinary bladder from which they pee. We see mineralizations within the urethra. It causes a lot of irritation. They're no longer able to urinate because it causes an obstruction within the urethra. And it's a pretty serious emergency. It starts off painful for them. Sometimes we'll see some signs leading up to it where they are straining, maybe in and out of the litter box, still peeing, maybe peeing small amounts, having a lot of urgency, but kind of being pretty painful. The reason I'm doing this video today is that my own little boy kitty recently blocked. We're at about day 7, day 7 today. He's doing better, so I'm very happy about that. But, it really made me think and realize that, while as a vet, we send home discharge instructions and we spend a lot of time talking about all the different things that you can do at home for these little cats, it's still really scary, right? And sometimes it can be hard to memorize or to understand or to really be able to let all of that information sink in a meaningful and valuable way. And as I was going through it myself with my sweet little cashew cat, I was very grateful that this is a spiel that I talk to clients about on a very regular basis. Unfortunately and sadly for these little kitties, we see this pretty often. It tends to be something that we that happens, that occurs at times of stress. We tend to think that the physiology or pathophysiology of it is very similar to interstitial cystitis that many women, human women, can get or suffer from. And it's associated with stress. Cashew's a pretty cool cat. He sits for treats. He goes outside for walks on his leash. He visits different clinics with me. He loves it when people are in the house to come and see them. But I recently had to have some foundation work done in my house on the lower level, which is a ground slab. And it required several days of a self-leveling compound being applied to it. And I think that, and so because also Cashew is quite curious, I had to keep him in the bedroom for several days periodically across that 4 days. And of course, he had water and he had his litter box and little beds, and tried to keep him out on his harness for as long as I could, so that just trying to keep him from coming down into the lower living room. But I think that was stressful enough for him, because it was just a couple of days after we finished the floors that he was very painful in the morning, posturing to go potty. Initially, his bladder was very small, but he was so painful and so sad. And ultimately, he was obstructed. We did the radiographs. There were no stones. His kidney values were fine, happily, probably because I caught it so soon, so early. It was right away in the morning. But again, what it really reminded me of is this is so scary for us as pet owners. As a veterinarian, particularly as an emergency doctor, we see these kitties commonly. It's not uncommon, we'll have 1, 2, or 3 of them sometimes in the hospital all at one time suffering from this same ordeal. So we deal with it a lot. But when it was my own cat, I just completely lost it. And I really had that strong realization of how much this hits home and how terrifying it can be as a pet owner who loves these little creatures. So I wanted to take a little bit of time today. One of my dearest friends has been urging me to do some mini videos like this for a little while, just chatting with pet owners in a way that we sometimes don't have the opportunity to in the clinic. So I'm happy to say that Cashew is feeling better, but before I get everything entirely cleaned up, and I'll kind of walk through the process of all of that, I wanted to kind of show some of the areas that we stayed in, some of the things that I think helped in his recovery, and also in me being able to see when he wasn't doing well once he did come home. And I just hope that it helps somebody out there who has a little cat at home or has a little kitty who's maybe still in the hospital and you're trying to get ready for what to do once you do get home with little kitty. One of the biggest things and one of the biggest keys I think to consider is that a lot of the medications that these little cats are going to be going home on are sedatives and pain medications. One of the sedatives acts to help relax that urethral sphincter, to reduce the spasming and the pain that they feel. There's Cashew now. He came up to say hi. There's my sweet little friend. And so it's not uncommon that they'll go home on 2 or 3 medications, maybe more, that are all strictly for pain, pain medications and sedatives. With that, they are not in their right mind. They also just had a lot of trauma to their urethra, specifically their little penis, and they're gonna feel not normal. And so it's not uncommon once they've been catheterized, having a catheter, a small little plastic tube placed to relieve the obstruction within that urethra. It's not uncommon that they can have some spasms in there, can be painful. There's still the inflammation within the urine until all of that clears. So that urine, right, we don't know for sure, but in females and women, it tends to be, people describe it as very painful. It burns and you just feel like you still have to pee, even when there's no urine left in your bladder. So it can be quite irritating to them. And so with all of that, it's painful to go potty. They're feeling a lot of urgency. They're sedated out of their mind, right? They're on pain medication, which is really making them feel dysphoric and hopefully euphoric. But they're not feeling normal. And so it's not uncommon that they'll go potty outside of their litter box. When Cashew first came home, he would kind of sit, kind of like a donkey sit with his little legs up in the air, and he would just dribble pee out. That happened for the first couple of days. I was happy that he was peeing and he wasn't straining. He was just so sleepy, and he realized at a moment's notice that he had to go potty, so he would just sit there and go potty. So the first things that we did, the first night that he came home, the first night that he was home, after he was finished getting unblocked, I had the lower living room all done up with blankets and towels. We have a little portable heater that I had out. There's a heating blanket on and lots of small little kitty heating pads. Basically, the floor was completely covered in blankets so that he could be comfortable. I could be comfortable knowing that he's not going to be peeing all over my brand new floor, literally, that was just placed last week. But also making sure that he had access to everything that he needed. There were absolutely times that I was very grateful that I was a veterinarian because I could assess his vital signs because he was so tired. Had I not had that training, I probably would have been that person calling the clinic and describing what was going on and how sedate the cat was, and how concerning that was and alarming it was to me. But I literally had to talk myself off that edge. Be like, no, his heart rate's fine. He's responsive. When I call his name, he sort of opens his little eyes. It can be scary, especially those first 2 to 4 days after coming home once they've been unblocked at the hospital. So again, lots of blankets. So I'll give you kind of a little show. There's our little heater that we had, nice, comfy, poofy blankets. A lot of the blankets and the towels I've already picked up just because it was so much and he's starting to feel a lot better. So initially the litter box was over in that area, right over here. And having litter boxes all throughout the house isn't something that we're going to maintain. And so once they start feeling better, you do want to very slowly move the litter boxes back to their normal position. So right now I have a litter box here with a bunch of towels and stuff around it, both of the cats are using it. They're doing a great job of going potty in the box. Cashew's no longer leaking, but I don't just want to take that litter box and put it right back up in the kitty room, because sometimes cats get really happy and comfortable with where they're going potty, and I don't want him to start peeing on the floor because I've moved the box too quickly. So lots of boxes. This box will stay here for another day, and then I'll move it up a little bit closer to the bedroom for 2 or 3 days, and then gradually inch back all of those litter boxes back into the room where they normally are. So that's really the biggest thing. Lots of blankets, cover your floors, make sure that it's kind of pee proof. These cats aren't being bad and peeing on the floor, right? And we don't want to just keep them, if it's at all possible, we don't want to keep them just locked in a room, because that's going to be very stressful for them. We want to give them as much calming energy and zen energy, if you will, as we possibly can. So letting them have their own free roam of their home, but making it extra floofy, but also protected, so our houses aren't smelling like cat pee after all of this is said and done. We want to make sure we have plenty of water available for them and food, access to food. Again, these little kitties are sleepy. They are not going to have the wherewithal to go walk over to their normal food dish. And so particularly for those first couple days when they're so sedated, we want to be bringing their food and their water to them. Highly likely, if you have a blocked cat that's recently gone home from the hospital, you're going to have a plethora of medications, some written scripts, some cans of food, maybe some bags of food for the kitties to try. But you also want to have kind of some of their favorites. My little Cashew really likes churu, and so the first couple of days, really the first day, that's all that he would really eat. He didn't want to touch any of the other food. And while the prescription foods are specifically formulated to reduce that mineral matrix development, we also just want the cats to eat. So if they're not going to eat that prescription food, the key is getting them to eat any food. The more water we can get them to take, the better. So if it can be a canned or a soft or a wet food over a dry food, that would be preferred. So bringing water to them, making sure that in the area where you and kitty are, there's easy access to litter box, plenty of different varieties of food, easy access to water, warm blankets, little heaters, heater pads. Use caution with the heaters. One little note, Cashew really likes to be warm, and so at least for him, having lots of heating elements was really important to me. And I showed you the heater a moment ago. He and the other kitty will typically give themselves a reasonable distance from their bodies to the heater, but with him being so sedated and sleepy, he was trying to like head boop it and trying to give it nose boops. I started naming the heater Mama because he just wanted to curl up, literally touching it, and it was just too hot for him. So being aware of where they're at, making sure that they have safe heating elements available. So Cashew was never with the heater turned on when he was not under direct supervision. So he could only have heater Mama on if I was sitting immediately there and could continue to like move him away from the heater because he was just so enamored with heater Mama. Other things that I think are helpful to consider when you have a little blocked kitty that's recently come home from the hospital. We talked about the food. You're gonna have a lot of different foods. Be patient with these little guys. They don't feel good. They're feeling pretty picky. Their tummy's upset. Sometimes we'll send them home with anti-nausea medication. So if they're not eating well, it's not wrong to ask your veterinarian for maybe some anti-nausea meds, maybe a little appetite stimulant for a couple of days just to give these guys a bit more support in their recovery. Again, patience sometimes as well. You know, I think that these cats can become averse to some of the food. So let's say they were eating it really well for the first day, and then maybe they had a back step. Poor little Cashew, he came home, and then a couple of days later, he started going in and out of the litter box a lot, peeing these tiny little like marble-sized amounts, and the urine was bloody again. He actually developed a urinary tract infection, a pretty nasty one, probably just secondary to contamination from having that catheter placed. So he was irritated in and out of the box, and again, he was eating initially, but then he started to not want to eat. And now, this many days later, he's a little bit fussy with those first few foods that I tried. And I'm wondering if it has to do with him just associating feeling so poorly while he was eating those foods. We'll see how it goes over the next few days. Hopefully he'll start to be energetic about those foods again, because he really, ideally in a perfect world, he would be eating the prescription diets for this condition. But you might have to get creative with some of these guys. Similarly, using treats to try to get them to take some of their medications. The medications alone can be a lot. At one point, Cashew was taking 6 different medications, several of them 3 times a day, a couple of them just once a day, and it was a lot. Personally, I prefer tablets or smaller pills when it comes to kitties. A lot of kitties really, really hate that liquid medication. But if you have a cat, especially in advance of all of this, see if you can train them and kind of teach them to take treats. These soft little treats can be really amazing and really fantastic to be able to take some of these medications in. Cashew will do tricks. We were training him on this before. And so now, if I give him a little bit of this Greenies pill pocket, he takes it like a treat. I get some of his medications out, wrap it up in the little pill pocket guy, and just give it to him right away. And he just thinks that he's been given a treat, and he gets most of his medications like that. So that made that part of it a heck of a lot easier. We can really struggle with trying to get the medications in these kitties in a low stress way. Because remember, this is a stress-induced condition, and we want these guys to be as comfortable and calm as possible. So having a nice chill space. If you can, try to keep in mind whatever their most comfortable area of the house is. So if they have a favorite part of the house, for my little kitties, it's our little window here. Normally there aren't the additional blankets. They always have their little heating pads. And so I put the extra blankets out there to hopefully keep some of the cat urine off the cushions. But really this was just their little jam. Cashew spent many hours hanging out on his little warm pad there. I gave him some extra covers because while it's sunny outside today, it is winter here. And the house gets pretty chilly sometimes. So making sure that he is comfy, has a warm pad available as an option, extra little blankets to keep him nice and cozy. And we spoke a little bit about litter boxes, but another key is making sure that they have plenty of litter boxes available. So there's the one litter box downstairs. I have a tri-level house. I had litter boxes on every level. And then that evening, I've actually had a litter box in my bedroom as well, because the cats sleep in the bedroom. The doors are all open, but that's where they prefer to go. Again, covered completely around the area of the litter box with blankets and towels, just because these little guys are gonna go to the litter box, get out, sit down, and then continue to dribble or spurt urine. That's not uncommon. So keeping them all on our good sides and not getting upset with them when they're doing that, because I know how frustrating and how challenging it is to try to get cat urine smell out of anything, particularly carpet or flooring. It can be really challenging and be really frustrating. So I don't think we talked about feel away yet. I personally really think that feel away, some of the pheromone supportive mechanisms can be really helpful. I personally like the plugins. I can plug them in and just forget about them. It's essentially a little feline pheromone or a hormone that imitates mom's pheromones from when those little cats were baby kitties. It's supposed to give them a relaxing feeling, calm them down, and seems to be particularly helpful in these kitties with urinary tract issues or inflammatory issues throughout their body. So I have several Feel Away plugins throughout the house. Lots of water throughout the house, lots of litter box, blankets, nice cozy areas. Luckily, I've been able to be home with him most of this past week, so I can keep a really close eye on him and make sure he's getting all of his medications every 8 hours. And getting as much food, love, and TLC as he possibly can to get him hopefully back to normal as soon as possible. So I hope this was helpful. There's little baby cat one more time. If you have questions, I'll keep an eye on the chat, on the comments, and respond as I'm able to. And if this is something that is